Hello, good evening once again and welcome to my YouTube channel. This is Dr. Mike. Magandang gabi po, magandang umaga, magandang hapon po sa lahat ng nanonood. So good evening once again to all of you watching our YouTube channel. And before anything else, I wanna greet all our subscribers because we achieved 1,000 or we reached 1,100 plus subscribers today. And maraming salamat po sa pagtangkilik sa atin. And asahan nyo po that we would improve our channel. We would improve the content ng ating YouTube so that mapaglingkuran po kayong mabuti at malaman po natin, ma-understand natin ng tama ang mga health issues na binibigay natin o pinipresent natin tuwing gabi. So again po, from the bottom of my heart, maraming salamat po. Ako po si Dr. Mike, yung hindi pa po nakakakilala sa atin, at yung po mga bagong subscribers natin, maraming salamat din po. And hindi ko po papatagalin ang ating discussion tonight because some of you, okay, I've been receiving many messages from you and you keep asking me about migraine because there are some OFWs, overseas Filipino workers here in Hong Kong, our beloved friends, our domestic workers dito po sa Hong Kong, they suffer migraine. And it is but appropriate to discuss tonight what triggers migraine, what causes migraine, what are the symptoms of migraine, the different stages of migraine, the risk factors, the treatment, the prognosis, and also when to see a doctor. Ito po yung discussion natin tonight, and I hope that this lecture magbigay po ng lesson sa inyo kung paano natin maiiwasan and also how to prevent and paano natin kung paano natin tatanggapin, paano tayo manggagamot doon sa mga taong nakakaranas po ng migraine. And if you have questions, feel free. We have some viewers here watching tonight and I'll try to answer as much as I can yung pong ating mga questions sa ating mga kababayan. Also, doon po sa ating nag-private message po sa atin sa Facebook po natin. So I repeat, tonight we will discuss what is migraine, what causes migraine, what are the symptoms of migraine, what are the stages of migraine. Probably some of you have experienced the different stages of migraine, the risk factors, what are the treatment, how do doctors diagnose migraine? Because some of you might be thinking, oh, meron akong headache. Akala nyo headache lang siya. O akala nyo migraine siya. So there would be a difference dyan. So hindi ko na po papatagalin. Good evening po sa inyong lahat and let's start our discussion. Okay. Let me give first a definition of what migraine is all about. Migraine is a medical condition where meron pong severe pain, okay, pulsing sensation dito po sa brain natin. Usually, it's a severe form of headache, usually on one side of the head. So, kalahating side po ang masakit. Either sa right side or either sa left side po ng brain natin ang masakit. Okay? It is often accompanied. Meron pong pasyente na nauseated. Some patient may vomit. Some patient are sensitive, extreme sensitivity to light and sound. Tandaan po natin, migraine is a severe form of headache, throbbing pain. There's a pulsing sensation. Okay, parang pinipiga ang brain natin. Usually, one side ng brain ang affected. Either the left side of the brain or the right side of the brain. And it is accompanied with three symptoms. Nausea, vomiting, pagsusuka, minsan parang nahihilo-hilo ka. And then, the sensitivity to light and sound. Ayaw mo maliwanag, nag-trigger sa'yo yun. Okay? Sumasakit lalo ulo mo. O ayaw mo maingay. Okay? Migraine attacks can last from hours to days. Tandaan po natin yon. So, pwede pong short period of time at meron pong aabot siya ng ilang araw. And usually, the pain that I am referring is a severe kind of pain that your daily activities, hindi nyo na po magagawa yung mga daily activities nyo. Nasisira yung buong araw ninyo because of the pain that I have mentioned. And meron pong trigger sign ang migraine. Okay? People having migraine, they often experience yung tinatawag na aura. Okay? In Tagalog, aura. Okay? So parang meron siyang nasisense na may mangyayaring sakit sa kanya. Ano po yung aura na yon? Usually the aura before the headache. Okay? Para may pangitain na may mangyayari sa kanya. Okay? Ano po yung aura na tinatawag na yon? Usually, the aura is visual. Meron pong mga flashes of light na nakikita ang pasyente o yung taong nagsasuffer ng migraine, or there's a specific blind sight o blind spot doon sa pag nakikita. Hindi niya nakikita yung ibang part. Okay? There's disturbances dyan sa pagpaningin ng pasyente natin. Also, there's a tingling sensation on the side of the face. Maaring parang may gumagalaw or merong something na nangyayari sa face mo or sa arms or sa legs. Minsan nahihirapan din ang pasyenteng magsalita. So ito yung mga tinatawag na aura. So before mag-trigger ang headache, meron munang aura. Okay, usually ang pasyenteng may nakaka-experience ng migraine, ang treatment usually dyan ay the medication, mga pain relief or mga home remedies, meron din, or lifestyle changes. Okay? So let's move on to the specific signs. Okay? Migraine usually occurs mula bata from childhood to adulthood or mga adolescent. It has 4 stages. Migraine has 4 stages. Isa-isahin po natin ang 4 stages of migraine. The first one is prodrome. The second one is the aura. The third one is the attack stage, and the last one is post-drome. Okay? Not all individuals experience the 4 stages of migraine. Maaring aura kaagad siya, maaring prodrome at saka aura, or maaring wala siyang post-drome, or maaring attack siya kaagad. Okay? Tandaan po natin yan. So, 4 po na different stages ng migraine. Not all these 4 stages can happen to our patient. The first stage, let's discuss individually yung mga stages na yun. Okay? The first one is what we call prodrome. Prodrome, usually it occurs from 1 to 2 days before the migraine. So, 1 day or 2 days before mag-appear ang migraine mo. Parang warm up sa kanya. Usually, patients under this stage, sa prodrome, they experience the following symptoms. Frequent yawning. Oh, inaantok siya. Lagi siyang nagyuyon. Pangalawa, there's an increased frequency na gusto niya uminom lagi. Okay? Thirsty siya. Okay? Another one is frequent urination. Okay? Next, patient may experience neck stiffness. O, parang sumasakit ang liig niya, nagkakaroon siya ng stiff neck. And then, patient with migraine under this prodrome stage, they crave for food, they crave for sweets. Either they crave for sweets, sour, etc., or salty. Okay? And then, some patients may also experience mood changes from sudden sadness or loneliness, similar to depression, and then euphoric, medyo high siya, medyo masaya siya. Okay? And then, other patient may experience constipation. So these symptoms are under the first stage of migraine. Tandaan po natin, prodrome. Okay? Yung prodrome na yun, usually 1 or 2 days before the headache, before the actual migraine would appear, and the following symptoms, from constipation to yawning, to craving food, particularly sweet, neck stiffness, and also mood changes. Okay, that's the first stage. The second stage of migraine would be the aura. Ito yung sinasabi natin kanina. Some people, aura might occur before or during the migraine itself. Okay, and aura is usually a symptoms of the nervous system. And the aura are usually visual. So ito po yung mga nakikita natin, mga disturbances sa paningin natin. Okay? And it would build up. Hindi po kaagad lalabas silang lahat, yung aura. So nagbi-build up po yan from specific hours hanggang specific minutes hanggang aabot po ng 20 to 60 minutes based on research. So pag nagkakaroon ka ng aura, usually po nasa time frame of 20 minutes to 60 minutes lalabas po yung visual disturbances ninyo. Okay, so ano po yung mga examples ng aura? Okay, visual phenomenon. The first one is you see various shapes. Okay, marami kang nakikita. Pag tinikit mo ang mata mo, inano mo, malabo, tapos ang daming, nakakakita ka ng circle, nakakakita ka ng rectangle, pyramid, etc., etc. And there are some flashes of light. Okay, na yun po yung tinatawag na aura. Or suddenly, nawala yung vision mo, lumabong bigla ang mata mo. Okay, that's another type of aura. Or sometimes, you experience parang may tinutusok kang karayom sa katawan. Okay, particularly sa arms or sa legs. And then, there's weakness or numbness ng isang part ng katawan, either sa face, okay, or sa body. Difficulty of speaking, hearing noises or music na wala naman naririnig actually sa paligid. Ikaw lang ang nakakarinig ng music na yon. Or there's uncontrollable movement. Okay? Yun po yung tinatawag na aura. So from prodrome, pangalawa po ng stage ay yung tinatawag na aura. Maaring yung pasyente natin, they jump right away sa aura. Wala sila nung prodrome. O kaya naman, prodrome sila, kukunti ng aura, then tatalon sila kaagad dun sa attack. Lilipat kaagad yung signs and symptoms niya. Okay, for the next stage. Okay, after the aura, ang susunod pong stage, yung pangatlo, ito po yung tinatawag na attack. Okay? Attack stage. This one, meron ng symptoms and the migraine would last from 4 hours to 72 hours. So ito ahaba na siya. Aabot ng 4 na araw kung left untreated or mas mahaba pa. So it depends. If patients would medicate or punta siya doktor, uminom siya ng medication, mas shorter. Okay? Mas shorten yung kanyang headache. If not, maari pong hahaba pa siya. Okay? And it depends po sa person to person. Depende sa tolerance ng pain niya. And then, pain is usually one side of the brain, either right or left, or minsan naman pareho po. Okay? Pareho masakit. Lahat masakit. Right side or left side of the brain. And then, yung pong pain, para po may pumipitik-pitik dyan sa ulo natin. There's some pulses dyan. And then you have the sensitivity of sa light, sound, or sometimes smell. Sensitive ka sa smell or touch. And again, patient might have nausea and vomiting. So ito po yung pangatlong stage. Pangatlong stage ng migraine. And the last one, yung pang-apat na stage po, ito yung after the attack, ito po yung tinatawag na post-drome. This time, yung patient, wala na yung mga signs and symptoms niya, pero ang nangyayari sa kanya, drain na siya. Okay? Pagod siya, confused siya, and parang nawala lahat sa kanya. Some people, nire-report nila, sinasabi na feeling exhausted or elated or sudden. However, pag gumalaw sila kaagad, okay, sudden movement may trigger ulit yung pain. So I advise some of the people na nakikinig sa atin, if you experience migraine, pag nandun na kayo sa attack, after the attack, wag po muna masyadong kilos-kilos kasi may tendency po na babalik siya. Babalik po ang pain. So pahinga lang po kayo. Okay? So, yeah, if you have questions, feel free. I would love to answer your questions later. When to see a doctor? So now, you know the stages of migraine. You know what migraine is all about, okay? And the causes of migraine. Now, when is the time, the proper timing to see a doctor, di ba? If you have headache, severe headache, syempre, tendency po, pupunta kayo sa doctor. Do not self-medicate right away, okay? If there's an abrupt or severe headache, okay, na parang pinipiga yung brain natin, you need to go to a physician. Next one, if the headache accompanied with fever or stiffness, or seizure, or double vision, yung mga banggit kong ibang signs kanina, or difficulty in speaking, you need to visit a doctor. Huwag nyo na pong patagalin. Or headache is accompanied by head trauma or head injury. So again, you need to go to the doctor. Or yung headache po ninyo, nag-worsen siya bawat araw. So you need to visit a doctor. Or there's chronic headache. Every month or tumagal yan, aabot ng 6 months, 1 year, lagi kang nagkakaroon ng headache. You need to visit a doctor. There might be something dyan. We need to see what's inside. Okay? Or pag umubo ka, inuubo ka, for example, or nag-exert ka ng effort or pressure like straining or sudden movement, galaw ka, biglang may headache kang na-experience, you need to visit a doctor as well. Or, ito po sa ating mga kababayan, if biglang nagkaroon kayo ng headache, if you experience new headache, bago, hindi nyo na-experience, lagi nagkakaroon kayo ng headache, bago kayo naka-experience ng headache, new headache, after the age of 50 years old. If you experience headache, 50 years old and above, please visit a doctor. There might be something dyan at gusto natin tignan kung ano yan. Okay? Okay, so sige, ayan, ang dami pong nanonood sa atin. Maraming salamat po. Let's move on. What triggers migraine? O ito, ano ba ang nagtitrigger ng migraine? What triggers migraine? I think some of our viewers watching tonight, they can relate what triggers sa migraine. The first one, the first triggering factor would be the hormonal changes sa mga kababaihan. Okay, because of the sudden fluctuation of the estrogen, which is very important, particularly during your menstrual period, during your monthly period, or during your pregnancy or menopause, this can trigger migraine. Okay, the second one, or because of, or people who are taking hormonal medications, mga oral contraceptive pills can worsen migraine. If you have migraine and you take oral contraceptive pills, umiinom po kayo ng mga pills, nagtitrigger din po ng migraine yan. Okay? And then, those individuals who drink alcohol, specifically wine, or too much caffeine. O yan, yung mahilig kumain uminom ng kape. Okay, too much coffee, it can trigger migraine. Or those individuals na mahilig lalo sa chocolates, okay? Or any caffeinated or may cocoa, it can trigger migraine. Okay? Another one that can trigger migraine is stress. Okay? Stress can trigger migraine, particularly stress at work, okay, or at home. So, ngayon po na nagkakaroon ng problem sa ating paligid, sa environment natin, this can lead to migraine. So, be very careful. Another one is sensory stimuli. Bright light, too much light. Too much light can induce migraine, okay? Or a strong or loud sound. Strong smell of a perfume can trigger a migraine. Paint thinner, yeah, particularly if merong nagpipaint sa paligid ninyo. Okay, or second smoke. Meron kayong katabi na nag-smoke, so pwede pong mag-trigger din ng migraine yan. Okay? So there are different ways or factors that can trigger migraine. Sleep changes is another one. If you miss sleeping or getting too much sleep, sobra-sobra kayong sa pagtulog, or you've experienced jet lag, it can trigger migraine as well. There are physical factors as well that can trigger migraine. Physical exertion can also trigger migraine. Pagbago-bago ng temperature, ng weather, mainit, biglang lalamig, malamig, biglang iinit, it can change or can trigger migraine as well. Okay? And then medications, as I have mentioned, oral contraceptive pills can trigger migraine, or some drugs that are vasodilators. Particularly, yan po yung mga iniinom sa mga may heart problem. Nitroglycerin sa mga may angina na pasyente. Food, okay? Particularly, yung pong kumakain ng aged cheese, yung mga blue cheese, yung mga processed food that can trigger migraine, and also those people who are fasting or skip meals. So dapat eat in moderation. And some food additives, particularly those naglalagay po ng artificial sweetener or MSG. Okay? Ito pong dalawang ito based on research, MSG and artificial sweetener. So yung pong naglalagay po ng aspartame. So be careful because it can lead to migraine as well. This would trigger migraines. Okay? How about the risk factors? So tapos na po tayo sa causes, tapos na tayo sa the stages of migraine. What triggers migraine? How about the risk factors? The risk factors for migraines, ito po, isa-isahin natin. First one is family history. If you have parents, if you have grandparents who have had a migraine, tendency po, you might have migraine also in the future. Pangalawa po, age. Although migraine can happen at any age group, although it would appear particularly po sa mga kabataan hanggang adolescent years. Although it would peak at the age of 30 years old na pasyente, okay? Or pag po medyo nagkakaedad na, mas less compared dun sa bata. Another one, because of gender, females are more prone to have migraine than male. Tandaan po natin. And then hormonal changes. Hormonal changes, particularly if you have monthly period, it can also one of the risk factors for migraine. Okay? Although magbabago po yan pag nagkaroon na po ng menopause ang pasyente natin. How do we diagnose? How do doctors diagnose? Okay, I repeat. If you have migraine, you need to visit your physician, and the physician should be the one to tell you that you have migraine. Hindi po yung kayo mismo magsasabi sa sarili niyo, oh, I have migraine. Kasi po, as I have said, dapat po ma-fulfill yung sinasabi kong mga criteria kanina or stages kanina or the signs and symptoms because there are other diseases that would present headache. Marami pong mga bagay-bagay o diseases na it would start as a headache pero iba po palang klaseng headache yan. Okay? Hindi po lahat ng headache ay related to migraine. Okay? How do we diagnose? Doctors would diagnose migraine. These are specialists. These are neurologists. Ito po yung specific field ng medicine na nag-handle po dyan sa mga pasyente yan. Neurologist po ang tawag doon. Okay? The first condition, the first diagnosis na pwede pong i-ano natin dyan because we need to be certain that the patient is suffering from migraine. Baka po kasi sumasakit ang ulo ng pasyente natin, bigay na tayo ng bigay ng gamot sa pasyente, hindi gumagaling. Those individuals asking me, kanina, I've been receiving so many text messages here. They keep telling me na, ano pong gamot? Ano pong gamot ang iinumin ko? How sure are you na migraine po yan? Okay? Tandaan po natin, chronic headache, one of the condition na experience ng ating mga pasyente is chronic headache. Ibig pong sabihin, matagal na headache, hindi nawawala. Inom ng gamot, hindi nawawala. Maari pong may iba pang problema nandiyan. Brain tumor can lead to headache. Tandaan po natin yan. Or may problema po sa brain natin na may tumutubo dyan because yung pong pressure, nag-exert ng pressure yung tumor na tumutubo sa brain. So tendency, pinupush niya yung ibang parts ng brain and tendency, it would lead to headache. So we need to, neurologists in particular, would always request two things. Either CT scan or the MRI. MRI, this one, it would use a powerful magnetic field para po makita, ma-visualize ang blood vessels natin, and also doctors will rule out. Ibig pong sabihin doon, makasure tayo na hindi tumor ang cause ng headache nyo or hindi ibang problem. Wala pong stroke, walang bleeding dyan sa brain, walang infection dyan sa parts ng nervous system natin. Okay? Huwag po tayong agad manggagamot. Okay? You need to visit a doctor kung pong lagi kayong nagkakaroon ng headache. Or another one is a CT scan. Okay? Para po siyang x-ray, cross-sectional ng brain, titignan yan, and doctors would also help They would help you to determine kung brain tumor ba yan, infection ba yan, or due to brain damage or bleeding sa brain or any other medical conditions or medical problems. Okay? Hindi po kasi ibig sabihin may headache ka, right away, iinom ka na ng iinom ng gamot. Hindi po ganon. We need to find the source ng headache. Saan ba nanggagaling ang headache? Usually po kasi ang ating mga pasyente, kaagad nagmamadali, nag-aas ng gamot. Hindi po ganon. Kailangan po natin malaman kung saan nagsisimula, saan nanggagaling ang pain. Otherwise, gagastos po kayo ng sobrang dami na hindi nyo alam kung ano ang cause. Remember, headache, iinom ka ng pain reliever, mawawala po ang headache. Pag inalis mo yung medication, babalik ulit. You need to find kung migraine po ang real cause niyan, at least we have supportive treatment for headache. At least makakasure po kayo na hindi brain tumor ang nagko-cause ng headache ninyo. Okay? Treatment. Okay? Treatment would be the following. There are medications that can be used for migraine. There are two types. The first one is the pain alleviating, relieving medication. So, ibig pong sabihin, kung meron pong headache, may pain, bibigyan po ang pasyente ng pain relievers. There are different types of pain relievers na pwedeng gamitin dyan sa migraine. However, as I have mentioned, rule out po muna natin yung ibang causes ng headache before po bibigyan ng doctor ng gamot for migraine. The second one, the preventive medicine. These are types of medications that we give to patient to reduce the severity or the frequency ng headache ng pasyente or migraine ng pasyente. I will not mention here the different types of medication. You need to visit your physician para po masuring mabuti kayo. Titignan po kung talaga pong migraine yan or ibang klaseng headache yan or i-rule out din po ang possibility na may infection, may bleeding, or may tumor na tumutubo po dyan. Okay? It's better po na ganun ang gawin natin kaysa iinom ka na ng iinom ng gamot na hindi mo alam kung ano ang pinanggagalingan ng headache. Okay? And then we have also the lifestyle and home remedies. So kung meron pong gamot na pain relieving medications and also the preventive medications, we also have the lifestyle and home remedies. Ano po itong mga lifestyle remedies na ito? Okay? Pag po nagti-trigger ang migraine natin, ito po yung ma-advise. This is based on research, this is based on scientific study. You need to go to a quiet room. Quiet room and dark room. Kung pong meron kayong aura at feeling nyo nagkakaroon na kayo ng migraine o sumasakit ng ulo nyo, at alam naman po natin yung aura is because of the light, because of the sound, you need to go to a dark room and you need to be in a quiet room. Close your eyes and take a rest or take a nap. Pahinga po. Okay? And then, I would recommend get a piece of cloth, malamig, or ice pack. Ilagay po yung ice pack na yon sa towel para hindi tulo-tulo yung basa. And then, ilagay po sa forehead or back ng neck. Okay? Para po ma-relieve ang headache ninyo. So, I repeat, kuha kayo ng towel or ice pack or yung ice bag, ilagay po sa forehead at ilagay po dito po sa neck natin. Okay? Other practices, ang ginagawa po ay ito. Try a relaxation technique. Just like what I've mentioned in our management doon po sa depression or anxiety. Develop a sleeping and eating routine. O ito po, huwag kayong mag-skip ng meals. Kung matutulog tayo, dapat may time din po tayo ang pagtulog natin. Okay? Drink lots of water as much as possible. 8 to 10 glasses of water. You need to hydrate yourself because water can help you. Okay? And then, you need to keep a record. Kailan ba nangyayari ang iyong headache? Ano ba ang nagtitrigger sa headache mo? Everyday ba yung headache mo or every monthly period mo ang headache mo? Do regular exercise like the following. Ito yung recommendation. Walking, swimming, and cycling. Yun po yung mga exercise na recommended. You need to do warm up. Tandaan po natin, pag nag-exercise po kayo, kailangan nyo po mag-warm up because kung hindi po kayo nag-warm up, pag biniglan nyo ang katawan nyo, it can lead to headache. Okay? Because of movement. Okay? And regular exercise can help you para po sa inyong migraine. Okay? And then, we also have the vitamins. I've discussed vitamins in the previous live natin. Please check that video about vitamins and minerals because there are certain vitamins that could help you as well as part of the preventive medications for migraine. A high dose of vitamin B, particularly vitamin B2, riboflavin, it reduces the frequency of headache, or coenzyme Q10, okay, is a supplement that would also decrease the frequency of headache. This is based on research. However, kailangan pang maraming study dyan to prove, okay? But at least we have vitamins and we have minerals that could help ito pong mga nararamdaman ng pasyenteng may migraine. And also, sabi sa study rin, ang mababang level ng magnesium sa ibang taong mayroong migraine, nag-trigger din ng migraine kung mababa ang magnesium. Okay? Magnesium supplement is important, so just like drinking milk or eating banana. But however, ito po yung mga study, okay, na binabanggit sa research, but it might help you itong sakit na nararamdaman ninyo. Okay? So in tonight, in summary, we have discussed what causes migraine or what is migraine all about. Okay, it's a severe type of headache, pulsating headache, and it can affect your daily lives. Okay, and usually it has an aura. Okay, and then the causes of migraine, we've discussed that. We also discussed the symptoms, common symptoms of migraine, from nausea to vomiting and the different classes or stages. The stages of migraine, the risk factors. Are you at risk? Yun ang tanong ko. Are you at risk and what to do? We've discussed the diagnosis. It's important that you need to visit a physician if you have a headache from time to time because doctors might rule out some other problems dyan po sa brain natin. And then, when to see a doctor if the headache is severe or if the headache is accompanied with other symptoms like head injury, trauma, or fever, seizures, etc., you need to visit your doctor. Okay? And what else? I'll try to answer some of your questions. And tignan ko po yung mga questions ninyo. Marami pong salamat, by the way, before anything else. Marami pong salamat sa 1,100 plus subscribers natin at sa ating mga new subscribers. And next Sunday, we will be having another live, 9:30 in the evening, all about vertigo naman. Kung na-discuss natin ang migraine tonight, we will connect it to vertigo. Ano ba ang vertigo? So, ayun po. Abangan nyo po yon sa Sunday, 9:30 in the evening. So, marami pong salamat sa mga nanood ngayong gabi, na-join sa atin. Greet lang natin sila. At mga subscribers natin all over the world. At mga bagong subscribers I mentioned. From Saudi, we have from Dubai, from US to Canada to Philippines to Hong Kong. Marami po. Singapore. Marami pong salamat. Lily, Nerissa, Salma, Elisa, Gigi, Mylene. Tignan ko po kung may question kayo. Ito. I always have pain in my right side of my head. Miss Gigi, if you have pain on the right side of your head, do you have the aura? Do you experience the 4 stages? If not, ano yung triggering attack mo? What triggers your migraine? Is it really migraine? Or ikaw lang ang nag-diagnose ang sarili mo? Okay? Because po, importante po that the doctors would see you or check you if it's really a migraine. Okay? Yes, there's an aura. Yung pong aura yung parang pangitain na pangitain. Ano ba sa Tagalog ang aura? Aura ang Tagalog. Pero ito yung mga signs na, senyales na mafe-feel mo na may paparating na something sa'yo. Okay? Either nga yung flashes of light or disturbance sa vision mo. Meron po ako, meron po ako migraine experience ko lahat ang sinabi mo. Okay, Miss I hope you see your doctor. I hope na napiprevent mo kahit papaano yung mga signs and symptoms. We also have a message from sa Facebook natin, is chocolate, but tuwing kakain daw po siya ng chocolate, ay nagkakaroon siya ng migraine. As I have mentioned, one of the triggering factor is caffeine, cocoa, lalo na sa chocolate, particularly if it's really dark chocolate, it can trigger migraine. Okay? Kung pwedeng iwasan or kukunti lang ang kakainin natin dyan. Miss Del Rosario, maraming salamat. Yes, it's nausea and vomiting are the common symptoms, aside from headache. What causes migraine? Miss Salma, I have mentioned what are the causes of migraine sa pasyente natin. And I hope you don't experience migraine. Okay? Ako natutulog at nilalagyan ko ng ice ang ulo. Yes, it's very good because one of the remedies, home remedies for migraine is to put ice pack sa forehead, sa head, o tsaka sa neck po natin para maibsan ang pain. Lisa, first and second usually nararamdaman ko pag may attack ako. Okay, thank you. 2 days before my period, may headache talaga ako. Normal ba yun? Yun nga, because of the things that's going on, hormonal thing, nagkakaroon ng headache. Okay? And please record your headache, Miss Gaviola, because titignan natin, migraine ba ang pinanggagalingan niyan or other factors? Connected po ba ang migraine sa mata? Okay, because migraine, ito pong minsan yung facial, trigeminal nerve. Specifically, there's a nerve that is being affected sa ating nagko-cause dyan sa migraine na yan. And maaari, but there's also medical condition. Kaya nga po kailangan natin, sino ba yung nagtanong? Nakalimutan ko po yung nagtanong, nasaan na? Sorry po na move. Si Miss Lira, kailangan po malaman natin, may problem. Kaya nga sinasabi ko, kailangan mo nang ma-rule out ng doctor. So, other problems. Is it problem of the eyes ba? Okay, as I have mentioned, may visual problem kanina. Or may other underlying problem, like a tumor, a brain tumor. Because pag may brain tumor, yung pressure, abang lumalaki yung bukol dyan sa brain, pinupush niya yung other organs, yung brain particularly, or yung mga ugat-ugat dyan. Okay, pag pinupush niya yon, syempre yung pressure, hindi nakakontain sa brain, nahihirapan, so merong pain na nararamdaman ng pasyente. Okay? Caffeine and chocolate, okay, trigger. Pag walang pera at masakit ang ulo, consider po ba migraine yun? That's a different factor. Okay? So, strong scent. Strong scent can trigger migraine. Perfume or fruits, durian. Yung iba ito nagko-comment, durian daw ina-attack ng migraine. Yeah, strong scent, okay? Paano po malalaman na may migraine ako? Kasi minsan masakit po ang ulo ko sobra. Medyo late din po ako. Okay. Miss Sheila, okay, regarding migraine, first thing to do is, yung headache mo ba ay right side or left side? So, tignan natin yun muna. Do you feel nauseated? Nagkakaroon ka ba ng symptoms ng nausea or vomiting? Pangalawa, nagkakaroon ka ba ng aura? Minsan, yung may senyales na may pangitain o mag-trigger na merong mangyayari sa'yo, like visual loss, okay, bigla lalabo ang paningin mo, and then, or, meron mga flashes of light kang nakikita, and then biglang sasakit yung ulo mo. Okay, usually yung mga triggers na yun naman banggit natin kanina. Okay, and again, we need to rule out again other factors, other medical conditions, because not all headache are caused by migraine. Because meron pong headache na brain tumor po or infection sa brain ang problema. Headache na walang pera. Drink a lot of water, that's a good advice, yes. And again, you need to take vitamins, you need to take vitamins and minerals. Please watch my other video about vitamins and minerals because it might help you para sa home remedy ng inyong migraine. Wala akong alam sa na-experience kong pain, mag-pain reliever lang ako, makakatulog minsan, wala pang gising, etc. But again, you know yourself better, and if you have these problems, please visit your physician. Huwag na po natin aksayahin ang time natin. If may nararamdaman kayo sa katawan, please visit your physician. Huwag po kayo kaagad-agad bibili ng medications. Do not self-medicate. You need to visit your physician. Because self-medication or pag nag-self-medicate kayo, baka po mag-worsen lalo yan ang condition ninyo. Hindi nyo po alam kung ano po ang possible na may possible problem ba sa brain and so on. It would be better an expert, a neurologist can help you and diagnose na meron po kayo talagang migraine. Again, maraming salamat po. And then, please watch our next episode, Vertigo, on Sunday. This is Dr. Mike again from the University of Hong Kong. Marami pong salamat at hanggang sa muli. Salamat po sa lahat ng subscribers and be safe, be healthy, and stay positive. Magandang gabi po at salamat.